Testing 1, 2, 3, 1, 2, 3. Welcome back to Med School Radio. We're talking about autoimmunity. This is our fourth video. So we're talking about systemic lupus erythematosus. And just as a final thing I want to say is when we are testing for this, what is it that virtually every SLE patient tests positive for? These are the ANAs. What are the ANAs? These are the anti-nuclear antibodies. And they have found a 5 to 15% of the normal population even. So remember that anti-Smith AG or AB somewhat specific for SLE, and that if you have anti-double-stranded DNA plus anti-Smith AG, this is virtually diagnostic for SLE. Okay, so let's move on and talk about other autoimmune diseases. For example, Myasthenia Gravis, and this is a type 2 hypersensitivity reaction. If you remember, type 2 are antibody mediated. So what is this disease marked by? What happens in this disease? Remember that we have progressive weakness and loss of muscle control. And what type of disease would we classify this as? Is it a T cell disease? Is it a B cell disease? Of course, this is a B cell disease. And remember that the autoantibodies against nicotinic acetylcholine receptors are what are causing the problem. Also, remember that you would notice ptosis, problems with the eyelids, and other manifestations we've talked about in previous videos. Remember, we're talking about autoimmune diseases. Let's talk about type 2 cytotoxic autoimmune reactions. Remember, this is involving antibody reactions to cell surface molecules. We've talked about this before, but this is without cytotoxic destruction of cells. When you get to type 3 hypersensitivity reactions, then you're going to see more destruction. But here we're talking about antibody-mediated problems. So, just as a review, Graves' disease and myasthenia gravis. Graves' disease is when you have the antibodies attached to the receptors on the thyroid gland and stimulate production of the thyroid hormone. And the symptoms here you would see would be a goiter, which is an enlarged thyroid, and bulging eyes. Myasthenia gravis, progressive muscle weakness. And the antibodies would be blocking acetylcholine receptors at the neuromuscular synapse. But today, remember that most of these patients survive in myasthenia gravis with drugs or immunosuppressants. Okay, so we have another question for you. What is the disease in which the body does not produce or properly use insulin, which is a T cell disease, and the T cells attack and destroy the pancreatic beta cells? This should be very obvious. Of course, this is diabetes. So here's another question for you. What type of reaction? Is it type 1, 2, 3, or 4 for the cell-mediated autoimmune reaction, and which is insulin-dependent type 1 or juvenile diabetes mellitus? Is it 1, 2, 3, or 4 diabetes mellitus? Of course, remember this is type 4. Cell-mediated autoimmune reaction. And we're talking about insulin-dependent type 1 or juvenile diabetes. Okay, another quiz here. What is it in which the myelin sheath is affected? And again, we have autoantibodies or self-reactive T cells which are responsible for demyelination. So of course this is multiple sclerosis. And what type of reaction, what type of autoimmune reaction is rheumatoid arthritis? Remember, in this case we have microbial mimicry, that we're having a mistake of the immune system. So in this case, IgM autoantibodies, rheumatoid factors, against IgG form complexes in joint, leading to inflammation, cartilage damage. This, of course, is a type 3 immune complex autoimmune reaction. Remember that there is no cure here. Thing to remember here about rheumatoid arthritis is that the problem is IgM autoantibodies reacting against IgG, which forms complexes in the joints. Okay, it's time to guess again. Okay, we're trying to guess this autoimmune disease. This occurs as a primary form or secondary form with rheumatoid arthritis, SLE, etc. And you'd have dry eyes, dry mouth, and the exocrine glands are infiltrated with